Intimacy after explant. It's something that we're all curious about, but you don't really hear anybody talking about it online or inside Facebook groups. So let's open up the conversation here. I'm going to share with you my own perspective, my own experience, and also some things that I've come up with to help you mentally prepare and be more mindful of after explant surgery in regards to being intimate with your partner. And after you're done watching this video, I would love to hear from you if anything that I talked about rang true for you and you experienced the same thing. Or maybe there's something that I left out because I didn't experience it or I didn't think about it that occurred for you when you were being intimate with your partner, and share it down below in the comments because I would love to know that myself. All right, so let's get into it. I would personally wait at least 3 weeks to have intimacy with your partner after your explant, only because things are still healing and rebuilding and repairing and might be swollen and might be hurting, and you might be getting those little nerve zaps. There's a lot still going on at that 3-week mark post-explant. So I would at least wait that long because you don't want to potentially hurt anything, rip anything, hurt your muscle, your incision area, anything like that. So unless you can be super gentle and take things very slow, then I would probably wait at least 3 weeks before getting intimate. For me, when I had breast implants in, they didn't really move too much. They always just kind of stayed in place. After my explant surgery, things definitely bounced and jiggled way more. And it was really cool to actually feel that for the first time in over a decade, but it was really weird. So definitely keep that in mind, that when you are being intimate, things are going to be moving and bouncing a lot more. And with that, of course, you want to be more cautious. When you bend over or if you are leaning over, things might look a little bit different. Mine definitely look a lot more like this and a little less like this, to give you that visual representation. So just to be prepared, things are going to look a little bit different for you and your partner when you are bending over, bending forward. If you are really small like me, then your belly might protrude a little bit further than your breasts, and you just kind of have to laugh it off, because at the end of the day, what are you going to do about it? It can make you a little self-conscious, but just to be prepared, if you are super small like me, that may happen. And something that I was not prepared for after my explant surgery, and I've talked about this in another video, was my nipples were so sensitive after explant surgery. I couldn't even have a shirt or a bra rubbing up against them. I mean, I could because I had to wear those things. But when they would really rub up against my nipples, they would be so sensitive. One time I took a shower and the water from the shower head hit my nipples and I screeched. It startled me so much. That's just how sensitive my nipples were. So definitely keep that in mind during intimacy, as things might be a little bit more sensitive. Or for some, you might be numb. It's pretty common to also be numb, have numb nipples or numb spots in your breast, just because of the nerves being cut and the muscles being cut. So 2 ends of the spectrum, or you could be normal, is you could be overly sensitive or you could be a little bit numb. And I feel if you are more on the numb side, you need to especially be more cautious, because you're not able to really feel something. If something's getting squeezed too much or touched too much, you might not realize it, and then afterwards you might feel a little bit aggravated. And you'll also want to be very mindful of your incision area, with sweating or with moving or anything. Just keeping that incision area really clean and really dry is going to help the incisions heal a lot better, heal a lot faster, and just look better overall. And the last thing, and this is really important, is to be very cautious when you're raising your arms or moving your arms too much, or if you're using your chest muscles too much, maybe pushing yourself up or rolling yourself over, anything like that. You want to be very mindful of what you are doing with your arms and with your upper body in regards to lifting yourself up or moving things around too much. If you do find that you are a little bit insecure and self-conscious after explanting, it's totally normal. I myself felt that way when I was getting intimate. I would wonder, like, what is he thinking? You know, this is all new to him, because when me and my husband first met, I had breast implants. So he didn't know what I looked like or what they felt like without having breast implants in them. My breast implants were always really hard and like really cold. And after I explanted, they're just super soft and warm. They feel like what I would think feels like just normal, healthy breasts. So it is really common to just wonder what your partner is thinking and all of that, but just try not to let your head go there during intimacy. And again, I know it's really hard and it's going to take work, but I feel like communication is really important during this time. Some things you can do to spice it up is wear really cute lingerie. Like if you're not too comfortable with showing them off yet, then maybe get like a cute little bralette or a cute little lingerie set and go that route. Or you could use toys if you're not like really comfortable with going full on out yet, and get romantic and light some candles. So let me know if any of this rang true for you, or if you had some kind of crazy, weird experience after explant in regards to intimacy that first time. I would love to hear it, and we would love to hear it, because this is a topic that isn't really talked about too much, but I know a lot of women really want to know, like, what can I expect? What should I be prepared for mentally and physically and all of that? So this is just a good start to let you know, like, things are gonna move differently, and just to be very mindful of your incisions, of your arms, of using your chest muscles, and things might look different in different positions. If you like videos like this, then be sure to subscribe. And if you are new to me, welcome. My name is Christina. I'm the founder of Size Happy, the admin of the best Facebook group on Facebook, Breast Implant Illness, Rejuvenation, and Education with Christina. And you can also find me on Instagram at I am Size Happy. I'll see you on the next video.